The Etonogestrel 0.12 Mg-Ethinyl Estradiol 0.015 mg per 24 hours vaginal ring contraceptives is a form of birth control that is placed in the vagina. It works by releasing a combination of hormones to prevent pregnancy. This product contains two hormones, a progestin called etonogestrel and an estrogen called ethinyl estradiol. It's important to note that while this contraceptive method is effective in preventing pregnancy, it does not protect against sexually transmitted diseases. It is recommended to use additional protection, such as condoms, to reduce the risk of contracting STDs. It is important to follow the instructions provided by your healthcare provider for the correct usage and timing of this contraceptive. This method is a convenient option for women who prefer not to have to remember to take a pill every day. Always consult with your healthcare provider to determine if this contraceptive method is right for you, and for guidance on the proper dosage and timing for your individual needs. Before using the Etonogestrel 0.12 Mg-Ethinyl Estradiol 0.015 mg per 24 hours vaginal ring contraceptives, make sure to wash and dry your hands. Once you have removed the ring from the foil pouch, fold it in half and gently push it into your vagina as directed. Keep the ring in place for 3 weeks before removing it on the same day of the week and about the same time that you placed it. If this is your first time using the ring, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. After removing the ring, do not wear a ring for 1 week, 7 days, and then insert a new ring on the same day of the week that you removed the old ring, whether or not you have your period. It's important to regularly check that the ring is in your vagina, especially before and after sexual intercourse. If the ring falls out during sexual intercourse and has been out of your vagina for less than 3 hours, rinse it with cool to lukewarm water and reinsert it. If it has been out longer than 3 hours, use an additional form of non-hormonal birth control for the next 7 days to prevent pregnancy. If you have left the ring in place longer than directed, you may still be protected from pregnancy if it's been up to an extra week, 4 weeks total. But if it's been longer than 4 weeks, you may not be protected from pregnancy. In that case, remove the ring and contact your doctor for further instructions. If the ring breaks at the well joint after placement, throw it away and use a new ring. If you have any questions or if any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of using the Etonogestrel 0.12 Mg-Ethinyl Estradiol 0.015 mg per 24 hours vaginal ring contraceptives include vaginal discomfort/irritation, nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, weight change, and vaginal bleeding between periods, especially during the first few months of use. If you miss 2 periods in a row, or 1 period if the ring has not been used properly, talk to your doctor about a pregnancy test. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects, and many people using this medication do not have serious side effects. However, it's important to monitor your blood pressure regularly while using this medication and tell your doctor if the results are high. Additionally, seek medical attention if you experience any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing eyes/skin, or symptoms of toxic shock syndrome. In rare cases, this medication may cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek immediate medical help if you experience symptoms such as chest/jaw/left arm pain, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath, unusual headaches, weakness on one side of the body, or vision problems/changes. Finally, if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. If you experience any other effects not listed above, contact your doctor or pharmacist. If you are a smoker over 35 years old, do not use this medication. Smoking while using this contraceptive can increase the risk of stroke, heart attack, blood clots, and high blood pressure. These risks become higher as you get older and smoke more cigarettes. It's important to avoid smoking or using tobacco while using this vaginal ring contraceptive. Before using this contraceptive, it's important to discuss any allergies with your doctor or pharmacist. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist of your medical history, especially if you have a history of blood clots, high blood pressure, cancer, high cholesterol, depression, diabetes, heart problems, liver disease, obesity, stroke, thyroid problems, or vaginal conditions. If you have diabetes, this medication may affect your blood sugar, so it's important to monitor your blood sugar regularly and share the results with your doctor. If you are planning to have surgery, be sure to inform your doctor about all the products you use. This medication may cause blotchy, dark areas on your face and skin when exposed to sunlight, so it's important to limit your time in the sun and wear protective clothing when outdoors. If you wear contact lenses, you may develop vision problems or have trouble wearing your contacts, so be sure to contact your eye doctor if these problems occur. Finally, it's crucial to avoid using this medication during pregnancy, and if you become pregnant or think you may be pregnant, it's important to inform your doctor right away. If you are breastfeeding, consult your doctor before using this contraceptive, as it may decrease breast milk production and have undesirable effects on a nursing infant. It's important to be aware of potential drug interactions that could affect how well your medications work or increase the risk of serious side effects. This is not a complete list, so it's crucial to keep track of all the products you use and share this information with your doctor and pharmacist. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. There are certain products that may interact with this contraceptive, such as aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Some drugs, like griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, and drugs used to treat seizures, may cause hormonal birth control to be less effective, potentially leading to pregnancy. It's important to inform your doctor when starting any new drug and discuss the need for reliable non-hormonal backup birth control. If you experience a new spotting or breakthrough bleeding, it's important to let your doctor know, as it may be a sign that your birth control is not working as well as it should. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. It's essential to inform lab personnel and all your doctors that you are using this drug. If someone accidentally swallows this product, it could be harmful. However, overdosing on this contraceptive ring is highly unlikely. It's important to only use one ring at a time. If someone has overdosed, try to remove the ring. If the symptoms are serious, like passing out or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It is important not to share this medication with others. While using this medication, it is important to have regular complete physical exams, which may include lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It is important to keep all medical and lab appointments and consult your doctor for more details. Make sure to refer to the product package for instructions on how to use the Etonogestrel 0.12 Mg-Ethinyl Estradiol 0.015 mg per 24 hours vaginal ring contraceptives. It's important to follow the instructions carefully to ensure effectiveness. In some cases, using backup birth control methods such as condoms or spermicide may be necessary to prevent pregnancy. If you find it difficult to remember to remove and reinsert the ring as directed, or if it keeps falling out, it's important to talk to your doctor about possibly switching to another form of birth control. It's essential to address any concerns or difficulties you may have with using the vaginal ring to ensure its effectiveness. When using Etonogestrel 0.12 Mg-Ethinyl Estradiol 0.015 mg per 24 hours vaginal ring contraceptives, it's important to store them according to the instructions provided on the product package. Make sure to check the expiration date and do not use the product after 4 months or after the expiration date, whichever comes first. Keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain, unless instructed to do so. Properly discard the product and it is expired or no longer needed. See also how to use section. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.